Agents, hey, this is Luis Moreno with Insurance Agent Training. All right, are you getting calls from some of your Medicare beneficiaries who are on a Medicare supplement and they are not too happy with the rate increases that they're experiencing? Well, guys, I'm going to share with you some options that you can offer them. Before I do that, do me a favor. Please comment down below. Please like the video so that more agents can get it. And if you're not a subscriber, please subscribe to the channel. All right. So what can you do? Guys, by the end of this video, I'm going to give you some ideas on what you can do for your insureds. So let's look at what happened to one of my insureds. Let's take a look at their rate history. So this individual started with me back in October of 2019. They started with a rate of $202. Well, the following year, it went up to $212. Then it went up to $220. So not bad. Okay, then it went up to $253. Man, and then $271. Then $293. And now we're at $334 a month for their Medicare supplement, along with the premiums for the prescription drug plan. Well, this insured called me and was not too happy. The conversation went a little like this: Luis, what is going on? Why do my rates keep going up with my Medicare supplement? I'm like, I warned you, there's a lot of positives to the Medicare supplements, like no network, you go wherever you want. She has a plan G, which means all she has to worry about is her deductible, a lot of pluses. But I warned her, hey, we're going to have rate increases every single year. Okay. Well, it's gone up more than 150% in 6 years. Man, and it's definitely getting to a point where it's not within her budget. So what can you do? All right, so let's take a look at the plan options. Okay, so number one is let's look at what's available. So you got plan F, plan G, and plan N. So F was the old Cadillac. You can't get an F anymore unless you were born prior to 1/1/2020. Okay, but why somebody would want to get it, I have no idea. Here is what I know about plan F. The rates in plan F have been going up quite a bit, okay, more than any other plan. Now, why is that? All the healthy people have left plan F and gone to a G or an N, okay, because they have to qualify medically. Your sick ones that don't qualify are have no choice, and they're stuck with that M. I'm sorry, with that F. So what's happening on that F, the rates, there's a lot of claims, and rates just keep going up and up and up. It's a sick pool of people. All right. So you never want to get into an F, but your options are to go to a G or an N. Okay. So why is it not easier? So a lot of agents, and especially a lot of insureds, think that AEP, the annual enrollment period, is when they can make a change. Well, not for Medicare supplements. The annual enrollment period is for Medicare Advantage plans and prescription drug plans. It has nothing to do with Medicare supplements. So the only way to move from one plan to the other is to qualify medically. It has to go through underwriting. And I'm going to share with you some of the health questions that these seniors have to answer. So that way you'll know and not waste time with a senior who's going to answer yes to some of these questions. All right, but before I do that, guys, let's take a look at these plan options again. All right, so you see the F's got everything on it. Every check mark, every box is checked off. If you look at the G, the only difference is the Part B deductible. It's $257, and it's an annual deductible. Now look at the N. On the N, you're missing that Part B deductible, just like the G, but you're also missing those excess charges. If a doctor charges more than the Medicare assignment, they have the ability to charge 15% more. Well, if they do that, the insured is going to be on the hook for it with the plan N. There's also copays for doctors and the emergency room. So realize that if they go with an N, they're not going to be subject to some copays. Got to factor that into whether the N is the affordability of the N compared to the G. When you take doctor copays into account, if that's really going to pay off or not. So it comes down to a math problem. All right. Now, in order to move from an F to a G, maybe a G to another G, a G to an N, or an N to another N with another company, they're going to have to go through underwriting questions. So I'm going to share with you what these underwriting questions look like. Okay, get that window open. Sorry, it takes me a little bit to open these things up. All right, let's go to page. Now, what I'm going to share with you guys here, let's take a look at this thing. So this is my smart book that I have created for agents. Okay, so if it's a reference manual, it's all that it is. I put it together. I used to walk around with a binder and have all this information in there, a little organized. Well, years back, I finally got organized. And now what I do is I put the smart book together that I share with agents. Now, guys, you do have to buy it. It's a one-time purchase. I'll put the link down below. And every year I update it with new numbers, new changes. Okay, so let's go. Here's the table of contents, is all the latest information. And the fact, the way I've organized this thing is from page 3 all the way to page 24. This is education for that Medicare beneficiary. And then from pages 25 on down is agent resource materials. So we're going to go to MedSup Underwriting, page 49. Get down here to port 49. Well, with this carrier, not only do they have medical questions, but they also have a height and weight chart. So double check your underwriting with the carriers that you're going to be working with. Here are some of the questions they're going to have to deal with. So if they answer yes to any of these questions, it's an automatic decline. Are they confined to a wheelchair or motorized mobility device? Are they currently hospitalized, confined to a bed, nursing home? Have they been diagnosed with any of these conditions? Have they had have they been advised to have a stem cell or organ transplant? Do they have osteoporosis with a fracture? Do they have diabetes with complications, including those other conditions? And do they have an implanted cardiac defibrillator? If they answer yes, the person is not eligible for coverage. Now, here's another set of questions where they may be eligible. So you answer these questions, a lot of hard, past 2 years, so going back, a 2-year look back, and they're taking a look at these conditions. And then the next thing is you're going to fill out medications that they're on, dosage frequency, and what the conditions are for. That's one carrier. This is another carrier here that I put. Okay, and you kind of look at the pattern, is the questions are pretty much the same. Okay, I don't see a lot of difference in the questions. So if your client's going to answer yes to one of them, it's probably going to be declined for the majority of the carriers. But you got to do your shopping and your underwriting, or you got to do a good job at doing that. So if they're healthy enough to qualify medically, then you've got the opportunity to move them to a different plan, or you've got the opportunity to move them maybe the same plan, but a different carrier. So you got to shop it. Now, what if this client doesn't qualify? Okay, what if they do not qualify at all because of medical conditions? The only alternative that they have, and they don't want to just cancel and go with Medicare A and B alone. Okay, is the only alternative you're going to have is move them to an MAPD. Now, guys, when you're taking somebody from a MedSup to MAPD, make them aware that they're now going to be subject to the network of whatever HMO or PPO plan you put them in. Okay, let them know that if it's a PPO, that they're going to experience higher costs compared to the HMO. It's a pay-as-you-go system, which means you're going to have co-pays or co-insurance for medical services. Okay, you're also, the good thing is that they put a cap on it, which is the maximum out of pocket. And they also, the beauty of this HMO or PPO MAPD plan you're going to stick them in is all the extra benefits they're going to get to sweeten the pot, and also the fact that they don't have to pay premiums. Pretty cool, but it's not the same animal. Okay, when they were over here, it was no referrals, no network, no pre-authorizations. Well, now over here in this MAPD world, you got to deal with referrals. You got to deal, if it's an HMO especially, you're going to deal with the referrals. You're going to deal with pre-authorizations. It's just a whole different animal. So make sure that your insureds are aware of that. And also make sure that you're doing your homework. Get their list of doctors, get the list of medications. Make sure that you're running the list of docs and meds against every carrier that you're going to recommend so that you don't leave them hanging. You don't want for you to enroll them into a plan and their doctor's not in the network, or a medication is not covered in the formulary. Do the best job that you can to find a plan that has all or the majority of the doctors, and the same thing with the medications. And if a doctor's not covered, a medication's not in the formulary, just let them know, hey, we got to find you a different doc for this, and this medication is not covered. You're going to have to go to your primary doc or your specialist that prescribed it and see if they can prescribe an alternative. Okay, there's nothing wrong with putting people into a plan where there's not a doctor or prescription. What's wrong is that they're not aware of it. You as the agent need to CYA as much as you can. So make sure you let them know, but you got to remember about these seniors. Tomorrow, they're going to forget that you let them know. So you need to make sure that you have it documented somewhere that you let them know. Either you're recording the conversation, or I would have them initial that you made them aware that this doctor's not covered, that they're going to have to find another doc, and also the same thing with the prescriptions. Okay, see, I've been doing this for a long time. Make sure that you CYA. You don't want a complaint, and you don't want to have anything to support what you're saying that you did, because then that complaint is a founded complaint, goes against your record, you get dinged, and you just don't want to be on anybody's radar. Okay, so make sure that you do that. All right, guys, hope you found that super helpful. Do me a favor, comment, like, and subscribe. Also down below, if you want to get the Smart Book, I have an ACA Smart Book, I have a Medicare Smart Book, I've got an ACA 101 course, I've got my CRM, Agent CRM, the best CRM in the world, guys, and it's designed for insurance. There's nothing else that it does. And not only use my link, so not only you get everything that they provide, but you also get all the workflows that I create. And finally, if you're an agent and you're like, man, how do you advertise? I want to get out there in social media and create some ads. I want to create Instagram ads. How do I do that? I've got a course. I partnered up with Shauna from Social Waves Media. She created a course that will teach you how to advertise on social media. I've had added to that course in the sense that what I do is I teach you, once you get that lead that Shauna showed you how to get, then how do we take that lead, plug it into the CRM automatically, and let the CRM work for you to warm up that lead so that when you do call them, they're ready for you. Okay, I've added that to her course. So if you want to learn how to advertise on social media, all that information is down below. Take advantage of it. And finally, guys, if you are not one of my agents and you're not in my trainings, I have 3 Zooms a week. Okay, and I go to 4 Zooms a week during AEP and OEP, where I do agent Q&As. If you don't have any training, any support where you're at, I have a community of insurance agents, Medicare and ACA, that you can join. It's a $50 a month membership. Not too bad, but join the membership, guys. You get the same training and support that I provide my agents that are under my downline. I'd be glad to have you in there and help you and support you so that you can grow your business. And everything that I share with my agents, I'm sharing with the folks in the community. All right, again, don't forget to comment, like, and subscribe. This is Luis Moreno with Insurance Agent Training.